morning. A week ago, you said that the next 2 weeks were probably going to be extremely important because the virus was set to peak. You said Americans should not go out unless it was absolutely necessary or an emergency. Is this still your recommendation? Should people still be staying home?
Well, you know, I try to always talk about where the virus is moving and where it's having the largest impact so the American people understand from our level who we're seeing getting infected and who we really want to ensure that's protected every day. And so we knew these 2 weeks were going to be very difficult for the American people because of the number of fatalities from this incredible virus and how it's moving through the population. We do see hope in the number of cases, the actual number of new cases decreasing day over day. But that, you know, the mortality will lag, and we'll continue that through this week. We really want to still ask every American to do what they're doing. I've been so proud to watch Americans social distance and do what's needed to stop the spread of this virus.
Dr. Birx, Trump said yesterday that he's looking to open some parts of the country by the end of the month. Most people think that's unrealistic and outrageous. We don't have a vaccine yet, so without that, when do you think it will be safe to reopen the country? Before the vaccine?
Well, you know, I'm a very data-driven person, and I don't like to average things. I think you lose the individuals and how things are going at the individual community level. I'm very much about focusing on the communities and seeing communities that have been able to really move through this epidemic with less infections, less deaths, less hospital admissions, and then the communities that we're seeing that are super hit so hard by this epidemic. And so when you look at that, you can see states where they have good surveillance up and running now, where they haven't really seen significant increases in cases. And so this has got to be done in a very laser-focused, data-driven manner. But as the data has come in, I think we're very confident that we can actually see places that could do very well with some decreasing restrictions.
Dr. Birx, you know, we have talked a lot about the timing of the response to the coronavirus from the administration. Many are very critical about that. Over the weekend, Dr. Fauci said that he couldn't deny that early mitigation efforts would have saved more lives. Now, we know that there might be a second or third wave of this virus. So are there any lessons to be learned right now about how to better respond to it next time?
That's a great question, and we have learned a lot. I just got here 6.5 weeks ago. I've worked on global health and HIV/AIDS around the world for decades, and it's been a real privilege, and still very concerned about the global outbreak and the pandemic that's occurring. What we've learned over the last few weeks has been quite remarkable. I think we have a much better sense of how contagious this virus is. When you hear these reports of, like when you hear from the cruise ships and from different areas where the communities are close together, and you can see from a dinner party, significant number of people being infected. So this virus is highly contagious, and contagious in a way that we haven't seen prior with other respiratory diseases, particularly the flu. I think the other complicating factor that worries me every day, because we see this in HIV, people passing the virus on to others because they're asymptomatic and they don't know they're infected. And so you have to do surveillance in a different way. You can't just wait for people to be identified as a case with symptoms. You have to have surveillance in place to really look for cases and asymptomatic cases. And I think that's really making this different than prior flu pandemic preparedness guidelines.
Hello, Doctor. This is Megan. The WHO said in January and actually tweeted that China found no evidence of human-to-human transmission of COVID-19. And then yesterday, President Trump doubled down on that in his briefing, criticizing them for their handling of this. And then he announced he is stopping funding. Do you think that the WHO mishandled this?
You know, in the beginning of every pandemic, and I've lived through several now, and I would take us back to where the HIV/AIDS pandemic, we didn't know how it was transmitted. We didn't know who was infected. We didn't have a test. Everybody was trying to do the best they could. And I think very early on in pandemics, you have to increase your level of reporting and transparency. Because it's a new disease, every word and every experience that you have becomes very critical for the global public. I think once this is over, we'll be able to look back and see, did China and the WHO say and do everything to alert the rest of the world to the nuances of this virus? Because when it first explodes, someone had to have known that there was human-to-human transmission. You know, I see how this has moved through the United States, and I can see how you can go from 1 or 2 cases to hundreds of cases and a high doubling rate, which we call, you know, the R0, and R0 values that some people predict could be 4 to 6. That's not subtle. And so you really have to go back and ask yourself, why wasn't there this level of transparency when this virus exploded? I think people would have prepared differently if they had known the level of transmissibility of this virus.
Yeah. You know, we pretty much trust the information that you're giving to the American public. But we also hear a lot of misinformation coming from other government officials and health organizations. Does it frustrate you that everyone doesn't seem to be able to get on the same page with this?
No, actually, Whoopi, I'm used to this. I work, you know, all around the world, and what's been really exciting to me when you do global health work is listening to the community and listening to officials and really understanding how people are looking at things differently. And my job, and I consider the most important part of my job, is to use information and data so that everybody can see the same thing. Sometimes when people are interpreting things differently, they haven't had the opportunity to really see and know the data and really understand how granular that has to be. Detroit is not Louisiana. Louisiana is not Philadelphia. Philadelphia is not Scranton. And we really have to understand communities. And I think that's the one piece I've been able to bring to this, and I hope I bring to it, is really clear discussions with the American people, because it's the communities, it's the American people and where they live that's changing the course of this pandemic.